Today I shall talk regarding HOPE3 and dyslipidemia management. Lipid Association of India has classified dyslipidemic patients into 4 groups: very high group, very high risk patients, high risk patients, moderate risk patients, and low risk patients. Accordingly, statin is given in a high dose or moderate intensity doses. Now, primary prevention of rosuvastatin in patients with no cardiovascular disease has been proved in Jupiter trial. HOPE3 trial was carried out to see the intermediate risk patients, the incidence of cardiovascular morbidity and mortality with antihypertensive drugs and statins. Almost 12,000 patients are subdivided into two bases. One group is antihypertensives with candicertan and hydrochlorothiazide plus rosuvastatin. Second group, rosuvastatin without rosuvastatin only. Third group is the no statins and no antihypertensive drugs, and fourth group is only antihypertensive drugs. Now these patients are followed up for almost 5.6 years, and the results were as such that there was reduction in blood pressure more than 6 mm of mercury, and the reduction in lipids, that is the LDL cholesterol, was more than 33 mg per deciliter, and there was almost 28% reduction in primary endpoint. Primary endpoint is cardiovascular death, incidence of non-fatal MI, non-fatal stroke, and secondary endpoints were primary endpoints plus the incidence of cardiac arrest, revascularization. And it had showed that the antihypertensive drugs are only effective in reducing the cardiovascular morbidity and mortality when the blood pressure was more than 140 millimeter of mercury. And the combined effect of antihypertensive drugs and the rosuvastatin was maximum in the group which received both the drugs compared to the patients who didn't receive any drug of this group. And the patients were followed up again for 5.6 years. This study is confirmed by the recently published trial from the ESC, which showed that the 10 mm reduction in blood pressure and the almost 1 millimole reduction in LDL-C, that is almost 38 mg%, reduced the cardiovascular events by 90%. So it showed the benefit of antihypertensive drugs with statins like rosuvastatin in intermediate risk groups with hypertension. Without hypertension, these antihypertensive drugs are of no benefit. The Lipid Association of India has subdivided these dyslipidemic patients into 4 groups. Very high risk groups where pre-existing established cardiovascular diseases, diabetes with evidence of end organ damage, or more than 2 major atherosclerotic cardiovascular risk factors present. Non-conventional risk factors are none. High risk patients where the incidence of having cardiovascular disease is more than 15% with death, MI or stroke over a period of 10 years. These patients should have more than three risk factors of atherosclerotic cardiovascular diseases, diabetes with 0 to 1 major cardiovascular risk factors and no evidence of end organ damage, CKD with test 3B and 4, familial hypercholesterolemia other than familial homozygous hypercholesterolemia. Familial hypercholesterolemia homozygous falls in the very high risk group category. Extreme of single risk factor like LDL-C more than 190 mg% or strong family history of premature established cardiovascular disease or heavy smoker. Moderate risk patients are where the incidence of having atherosclerotic cardiovascular disease is 5 to 15%, and they have the chance of death, MI or stroke over a period of 10 years. And the non-conventional risk factors in these groups are coronary calcium score between 100 to 299 angstrom units, increased intima media thickness, or aortic pulse pressure velocity raised, LPA between 20 to 49 mg%, and metabolic syndrome. And low risk patients where the risk of established atherosclerotic cardiovascular diseases, death, MI or stroke over a period of 10 years is less than 5%. and the conventional risk factors 0 to 1 major atherosclerotic cardiovascular disease risk factors. Based on it, the study was done, that is the HOPE-3 trial. HOPE-3 trial included almost 12,000 patients, and they were subdivided into 4 categories. Number 1 category with antihypertensive drugs in the form of candicertan and hydrochlorothiazide. Next group is antihypertensive drugs with rosuvastatin 10 mg daily. Third group is rosuvastatin only, and fourth group is without any placebo, both no rosuvastatin and no antihypertensive drugs. These patients are followed up for 5.6 years, and they carried out all the vital parameters. They like the major primary endpoint are death from cardiovascular disease and the incidence of non-fatal MI, non-fatal stroke, and secondary endpoints are primary endpoints plus the cardiac arrest and revascularization. At the end of 5.6 years, it was seen that there was reduction in the primary endpoint was almost 28%, and reduction in the incidence of secondary endpoints were 29%. Again, that showed that the reduction in blood pressure was 6.3 millimeter. Expected reduction of blood pressure was 8 millimeter, and the reduction in cholesterol, that is the LDL-C cholesterol, was 33 millimeter per deciliter. There was a significant reduction in both pressure and the cholesterol level, and that showed that those group who had antihypertensive drugs plus rosuvastatin, they fared best compared to those patients who didn't get any of these drugs. Now, the antihypertensive drugs is not effective for primary prevention in patients who had blood pressure 140 millimeter of mercury, and reduction in blood pressure more than 6 millimeter was achieved in patients who had blood pressure more than 140 millimeter of mercury, and they showed beneficial effects. Effects of rosuvastatin in primary prevention has been proved by this Jupiter trial, where they showed that the significant reduction in stroke and MI was almost 45 to 50% in almost 2 years time with rosuvastatin 20 mg daily. Now, subgroup analysis that showed that those patients who had normal blood pressure with rosuvastatin and antihypertensive didn't show any benefit. That means the primary that concept of polypill in primary prevention was disproved. Again, that showed the incidence of substantial reduction in blood pressure and mortality when the both groups are added together. Now, the recently published trial by ESC published in August 16, that showed the patient who are hypertensive on antihypertensive drugs and the reduction in systolic blood pressure more than 10 millimeter of mercury, along with the reduction of cholesterol, that is the LDL-C, more than 1 millimole, that is the 38 milligram percent, that showed the significant reduction, that is 90% reduction in major cardiac events over a period of time. So the effects of antihypertensives and this rosuvastatin is most in patients who are hypertensive, and the beneficial effects of rosuvastatin is added on the antihypertensive effects.